Hey folks, thanks for tuning into today's discussion. My name is Srihari. I am the co-founder and CEO of Space Wisdom. And today with me, I have Mohan, who is my co-founder and CTO. So today we are discussing about highlighting the transformative potential of IoT in healthcare, specifically touching upon enabling remote patient monitoring to enhance patient and the healthcare service delivery. Now, I'm just referring to my notes where the market research data done by a leading global firm says that the health tech market is going to be worth $1 trillion by 2027. And this is a global number going at a CAGR of 20% in the upcoming years. And the study also says that the Indian health tech sector, which was valued at close to $2 billion before COVID, is expected to grow at a CAGR of 40%, which is more than the global percentage and estimated to touch around $50 billion in the next 10 years. Now, to set, before we deep dive into this topic, Mohan, I just wanted to touch upon some of the best practices for remote patient monitoring implementation, the high level challenges, and some notes for future readiness. If you can just touch upon these points.
Hey, sure, Srihari. So the basics of healthcare system design are like, there are essentially four foundational pillars here, right? So just to kind of set context, when we talk about remote patient, it's not just the integrated devices or the IoT devices like the wearables and stuff like that, or the ones that used by telemedicine and stuff like that. Like it extends into the telemedicine, the video conferencing, all of that, the new innovations that are happening on this world, right? So coming to the first pillar, so first and foremost is the compliance. So we are dealing with highly regulated environment with data, everything. So whether irrespective of the market that you're in as of today, right? So in US, HIPAA is like the default. EU has GDPR that's come up. India has data protection bill that's come up very recently. So all of this is kind of enabling more data protection rights, privacy rights to the customers, to the patients. So this is something that's primary for anyone who's kind of working in this system to kind of keep in mind, right? As an extension to that compliance requirement, it goes down to the basics of it in terms of the data security, right? So one is, how do you store your data and data secure in transit, in your storage layers? How do you make this data available to third-party systems in a very secure if needed, an anonymized format, right? So that's something that everyone has to kind of take care of, right? The second part of it is kind of interoperability. So there's definitely a push towards a lot of these systems are kind of coming in as independent systems. Now they have to kind of start working together, the medical record or the health record systems and everything. So anything that we are designing today has to be kind of designed to ensure that we are not only talking as in silo, but we are kind of integrating with an ecosystem of devices, ecosystem of solutions here. And when we're talking about interoperability, we are also looking at sharing this data across to other systems that's not part of our ecosystem. So through US SSL7 protocol and stuff like that, India is coming up with their own. So that's another key part of it. The third pillar, it would be like accessibility. That for me is like the biggest friction point that the healthcare providers are facing today to kind of use the systems to digitally record this data and everything. That's why you see a lot of people just writing it down on paper and someone scanning it and then putting it across, right? So as accessibility should be a key driver to designing some of the systems in the future, right? So lastly, anything that we are designing today is going to evolve rapidly with a lot more healthcare providers as well as the patients kind of adopting to a virtual first touch point world. That will also help the system scale to provide the same services to a lot more people, right? So, and post-COVID, this has definitely seen a lot more push to it, right? So we got to keep in mind over the next couple of years, it's going to evolve extremely rapidly. So system needs to be very agile, very malleable, so that we can continue to kind of grow, adopt these systems.
Got it. So when we're talking about future readiness, right? Just describe the evolution of the IoT technologies specifically in the last decade, the role in facilitating remote patient monitoring, and it could be like the wearables, the home monitoring devices, the health applications that are coming in. So, how have you seen, the technology evolve in the recent years?
Yeah, sure, man. So probably a decade ago, right? If you had to kind of integrate with a device, let's say like a telemedicine opportunity where, your healthcare providers or healthcare technicians are coming and visiting you, kind of measuring all this data and stuff like that. So you had to kind of integrate each one of the devices separately. So they would come with a series of devices, even to monitor your heart rate, your SpO2, your ECG and stuff like that, right? So today, that's not the case. Like you have a wearable that kind of captures everything. For example, take an Apple Watch for that matter, right? So that already has heart rate, SpO2, ECG, all the vitals that you essentially need. That with these technicians kind of measure, all of them are kind of integrated, right? So the second key one is even on the hospital ecosystem standpoint and everything. So a lot of these devices are able to push data back, or there are layers in between that are enabled to kind of push this data back into the core EMR or the health record systems. So that's another key evolution that has happened in the last decade, right? And lastly, like I think when we were working on some of these telemedicine integrations and stuff like that, so we had to kind of go down to the level of Bluetooth layer, talk to the OEM, understand it. There were challenges with respect to that. And this itself was a big thing. But today, a lot of these OEM device manufacturers are already writing into some sort of data lake like the Apple Healthcare or the Google Healthcare ecosystem. So today, a lot of the systems can just read from there. And the choice of the device is not based on a specific manufacturer or an OEM or something like that. So it's kind of gotten commoditized at this point in time. When you could write in a system, your system can read from one of these data lakes and then continue to kind of use this, right? So that's essentially the core change that has happened over the past, right? The second thing that we are also seeing is telemedicine has kind of grown today, where a lot of chronic illnesses like the BP, the heart uh, patients, and also like post-surgery recovery monitoring, which is like very key. All of these
Right.
things are also adopting a remote-first approach today, right? So, and we have all these healthcare technicians who don't have to kind of come to your place, but they can monitor you remotely with very commodity hardware that's kind of available at an extremely low cost, right? And lastly, I think with AI coming in, I can definitely see the scale a lot more, especially in this remote monitoring space, where the number of streams that people can monitor can continue to kind of scale, the right pre-processing, the right alerting, all of this kind of handled by the model, and the healthcare technician is kind of validating the results of that. That will help significantly scale this entire ecosystem a lot, right?
Got it. But although, what we've seen is that, the healthcare system has not caught up to the population growth. If you see especially how the digital connectivity has penetrated all over, health should have been more accessible to patients, should have helped doctors ease their load, and kind of, also monitor patients in real time. But probably we are one step behind in that. Uh, there could be challenges, and do you see anything on the infrastructure side? Like, let's talk about in some of your projects. What are the challenges in infrastructure that you've seen? Right from selecting the right IoT device to interoperability to, let's say, scalability or user experience. What do you feel?
When we start talking about infrastructure, we can extend it into system design also, right? So one of the key things is like compliance. There's growing compliance on this domain. So which was already there in the US and the EU, it's also coming into our state also today, right? So any system design, we got to keep into mind that we have strict data residency laws, data security, data accessibility laws, which we got to ensure that we are maintaining it. So any data that's should be within the state, it cannot leave without consent. It should also any data that is kind of stored right from the capture till the end storage, it's kind of encrypted. So no one else can kind of access this data. Even if someone gets hold of this data, they can't make sense of this, right? And when we are integrating with any other third-party system, so one, there is definitely a ease in the ecosystem, wherein which we should be able to share from one silo, one platform to another platform with users' consent kind of coming in. The other part of it is when we kind of integrate to other systems, maybe we should also be looking at like data anonymization and stuff like that, right? So the another key driver here that we are seeing a lot more change is dealing with a lot more real-time data. So earlier we would read probably heart rate once, and then that goes into like EMR record, and that's to the extent of it, saying that hey, this was the heart rate, he's good to go. But today, when we are talking about remote patient and telemedicine, so we are essentially looking at monitoring the patients in real time. All this vitals information is coming as a stream to us. So ensure that the systems are kind of designed to handle this, ingest all this volume of this data that's coming in, create the right insights, use the right models to kind of process this, surface the right information to the technicians or to the healthcare providers who's kind of monitoring for this data, right? And these systems has to be elastic enough to scale to the requirements of the patients and the volume of data that's going to come in, right? So that's towards in terms of the data ingest, the data changes that are kind of happening. Lastly, coming to the IoT, the integrated device themselves, like we previously mentioned, it's kind of gotten commoditized at this point in time. You can pick up a lot more commodity hardware that are health grade at a very affordable price that's already writing data into a data lake like the healthcare, the Apple Healthcare or the Google Health, where your system can read from, and patients are consenting to kind of write into that data because that's much more easier. So your barrier of entry has gone low in terms of talking to the OEM, integrating to the Bluetooth level itself. So this will kind of drive the cost of remote patient health extremely low, according to me. Yeah.
Got it. Now, with so many technological advancements coming in, there's also challenges, right? Like about compliance. Now, on one end, there are regulatory frameworks wherein we need to adhere to HIPAA, FDA, GDPR. It could be data privacy, data security, right? Where encryption, access controls come in, and also certifications and standards. Just double click on that.
So this definitely, man, like you rightly mentioned, so there's already HIPAA in the US, GDPR in the EU, data protection bill in India and everything, right? So compliance is like 101, and all states are kind of pushing towards the giving more rights to the user. Like as a patient, I have more control over my data. I can say that, hey, you need to purge my data. You cannot store this data anymore and stuff like that. So any system design that we need to kind of design today, we have to probably take into consideration a lot of these to ensure that when we build and when we kind of scale this, it's also meeting not only my state's regulation, but I can take the solution to someone else, and so that it by default meets the basic requirements of all the compliance requirements, right? So that's one thing. The other one is like we already touched upon. So there's data security. You got to ensure that data is secure at rest, data is secure in transit, data that's accessed by the people are also in a very secure manner. They only have access to what they actually need, not everything. So that's something that has to happen. And the last is like data isolation also, right? Like all of these systems are kind of working in silos. So whatever that needs to be kind of kept to themselves, it has to kind of kept to themselves. Anything that can be shared, sufficient measures have to be put in place to kind of securely share this data to other systems to kind of integrate to this, so that no one can even by mistake access this data, and even if someone gets access to this data, it's essentially junk that they get to see, right? So that's like basic 101 requirements that anyone has to kind of follow, and developers needs to be educated. The community is kind of coming together. Definitely a lot more education is kind of happening, a lot more startups, and the ecosystem is kind of getting disrupted. To the entry point has kind of gone low, so there's a lot more people getting into it. That means a developer community is kind of growing, who are openly sharing some of this data, some of the utilities that's kind of needed to kind of build for this domain.
With that, there's also emerging technologies that are disrupting. We are seeing how AI is playing a key role in terms of infrastructure, 5G coming in. There's blockchain that can be incorporated for healthcare. So there's a lot of enhanced capabilities and efficiencies that a health tech software would elevate to. Now talk about designing remote patient monitoring systems, right? The scalability, the flexibility, and what do you think of future proofing it through innovation?
See, the future for me personally, we are kind of in that curve of evolution wherein which a lot more disruption is happening in the space. The future is really bright for me. One key innovation that I'm personally looking forward to and working towards is also this data share. Data is currently in silos. Let's say I go to hospital one, my data is kind of stored within hospital one, and if for some reason I relocate from here to another city or another country or something like that, so for me to kind of take this data, there's no way for me to kind of do this at this point in time. So in India, especially like how account aggregator kind of disrupted in the finance world, the same data silos from one bank to another is kind of disrupted now. So same thing is happening on the healthcare ecosystem also. That's kind of really good. So that when you go meet a new doctor, you're not only going and meeting with your current concerns, but the doctor also has access to your history. So that even if you must like they are not relying on you to kind of come back with your historical information, that they already have access to your history to kind of derive your prognosis and your history, right? So that's one thing. And another thing is like with this happening at the foundation layer, a lot more focused AI models and stuff like that can be built with patient consent, of course. So that would help these doctors or the healthcare technicians to it would have already done a pre-analysis of all your history and then giving you nudges and stuff like that, right? So that would help a much more equitable access to healthcare, right? So that's something that I'm also looking forward to here. So on the other side of it, the like we also touched upon, the hardware is getting more commoditized. It's getting more affordable at this point in time. So a lot more telemedicine, remote health systems can kind of evolve, they can kind of grow and make it more accessible to a lot more people, right? So what this can also mean is that this can enable a lot more primary healthcare ecosystems and to kind of share this data across if they need to capture this data, share this data across to the global community, and healthcare providers as a community, they can come together and help remotely, right? So that's something that I'm definitely looking forward to.
So Mohan, I've seen you and your team work on multiple healthcare projects. Right. So let's talk about some ground level challenges. You would have seen technology adoption barriers. There's integration complexities of multiple systems. There's uh, compliance hurdles. That can come in because of regulations that change very frequently, and there's continuous compliance adherence. So, talk about some of the challenges that you've come across and how the team has overcome it.
See, well, definitely technology when we say that it's the regulation, the compliance part of the challenge, it's kind of very key. We can't, I think it's important to ensure that there's sufficient guardrails. And as system designers and developers community, we kind of understand it and treat it with respect. I think that will get taken care, and these are all been there for a very long time. It's all of this is kind of commoditized. You exactly know how to kind of meet some of these, regulatory requirements and stuff like that. On the other side of it, the regulations and the compliance are also kind of easing towards a remote first approach to the entire healthcare ecosystem, right? So that is also kind of growing. I definitely see in the near future all of this kind of coming together to make it easier for the patients, make it more affordable and accessible to the patients, right? The another key friction point that I have always seen is the systems are normally designed in especially in terms of the UI, UX of it and stuff like that, are not keeping the doctor in mind, and they definitely see a lot more friction to kind of use the systems. So people, the doctors tend to kind of go back to their prescription notes and stuff like that, because for them to kind of use the systems is kind of really hard. So they would probably need an assistant sitting next to them to kind of, make this data entry and stuff like that, right? So, but on the side of it, system designers are kind of picking this up. They are making it much more easier because they see the value in capturing this data at source, at the source itself. So the UI UX of it is being more intuitive so that the doctors use it themselves together, right? And lastly, like we briefly touched upon in the past, there's definitely push towards the kind of making this, breaking these data silos that are there, right? So that patients can take their data from one hospital to another hospital. You're not just taking probably your written records and stuff like that, but also your digital records that can be transferred directly with consent, of course, to another hospital so that they have access to your entire history. So whenever you go from one place to another place, you're not kind of worried about carrying a bulk of your files and everything, which of course you can't, right? So right from a kid to your adulthood and everything. So this data is kind of stored digitally and that can be made accessible to everyone.
Mohan, and as we come to the end of this discussion, some closing thoughts is while the IoT and healthcare presents a lot of challenges, its benefits outweigh the disadvantages, and enabling remote patient monitoring and adopting innovation for the future is something that is going to be a significant leverage for all the healthcare providers. And we strongly encourage the stakeholders to embrace IoT in their healthcare service delivery. So, some closing thoughts on this, Mohan?
Sure, man. Like the future looks really bright with a lot of things coming together. With the healthcare providers also adopting a virtual first approach today, and to kind of meet the population scale around the world, we as a society also have to kind of come together to ensure that there's equitable access to healthcare for everyone. So it's definitely happening. There's definitely progress that's being made. As we are seeing, costs of the systems are kind of going down. The devices are becoming more affordable, stuff like that. So, and with AI also kind of coming in to the whole mix of it to kind of scale this virtual first touch point, it will definitely help everyone. I can definitely see a future where, we can have like an equal access to healthcare.
Great. And to all the viewers, Pace Wisdom has been fortunate and excited to be a part of all the innovation that's happening in the health tech space. Over the past years, been very grateful to a lot of clients for having trusted us with their innovation and making us their tech partner. So we'll keep updating you with more interesting, topics and updates happening at our end. So thank you so much for tuning in.
Thanks, folks.